Hi, welcome to Mama Baby TV, your best source for motherhood tips and solutions. Circumcision probably isn't something you think about every day. That is, unless you're about to welcome a new baby boy into your family. Then, regardless of whether it's something you've always known you'd have done or it's something you're still undecided about, you probably want to learn more about the procedure itself and all that goes along with it. What is circumcision? Male circumcision is the surgical removal of the skin that covers the tip of the penis. This piece of skin is known as the foreskin. Circumcision involves the removal of the prepuce, also known as the foreskin. Most males who are circumcised in the West, including the United States, have the procedure done when they're newborn babies. In some cultures, or for certain medical reasons, circumcision may be performed on older boys or adult men. You're not medically or legally required to circumcise your baby. But there are a number of medical, religious, and social factors you may consider when deciding whether or not to circumcise your son. You may already be confident in your decision to circumcise your son, or you might be feeling woozy at the mere thought of having a medical procedure performed on your new baby. So we'll give you the straight facts, the benefits, the risks, how it's performed, and how to care for your baby following the procedure, should you choose it. What are the benefits, as stated by respected medical groups? Circumcision is an ancient procedure going back thousands of years, which you may know if you're choosing it for religious reasons. It's also a well-studied practice. There are a number of extensive research-trusted source studies supporting the benefits of circumcision. The current American Academy of Pediatrics policy regarding circumcision states, evaluation of current evidence indicates that the health benefits of newborn male circumcision outweigh the risks. Some of the researched benefits of circumcision include decreased risk of urinary tract infections, UTIs, trusted source, especially in the first year of a child's life. Severe or recurrent UTIs can lead to kidney damage or even sepsis, by bloodstream infection. Decreased risk of contracting HIV, trusted source, as well as some other diseases that are shared via sexual contact. But it's important to remember that circumcision is not a preventative for sexually transmitted infections. Decreased risk of skin conditions, trusted source, that can affect the penis, such as phimosis. Lower risk of developing penile cancer, trusted source, although this cancer is very rare to begin with. Decreased risk of cervical cancer, trusted source, in the female partners of circumcised men. Many boys and men find it easier to maintain good genital hygiene when the foreskin is removed. But we do want to be clear here, good hygiene is good hygiene. Teach your child how to keep their genital area clean, foreskin or not, and they'll be in good shape. There have been studies indicating that there is no effect of circumcision on sexual sensation or pleasure. Other studies, such as this one trusted source from 2008, have found an increase in sexual sensitivity for circumcised men. While this can be an uncomfortable, and admittedly far-off, thing to think about when it comes to your newborn, it's worth considering. What are the risks of the procedure itself? As a new parent, you may be very nervous about this part. As with any surgical procedure, there are some risks to consider when deciding whether to circumcise your baby. To reassure you, circumcision is a very common procedure and complications are rare. But the risks may include bleeding at the time of the procedure, infection, pain, damage or deformity to the penis, which may appear later in development. The incidence of serious complications, such as damage to the penis, is extremely low, estimated to be as low as 0.2%, trusted source, and often occurring with circumcisions done outside of a hospital setting. The incidence of minor complications, such as bleeding or infection, is reported at around 3%. There certainly are risks to consider. But these risks are minimal when the procedure is performed by a trained medical professional in a sterile setting. Additional considerations to keep in mind about the procedure. We won't beat around the bush. Circumcision is a controversial procedure. Somewhere between 60 and 90% trusted source of boys born in the United States are circumcised. Worldwide, circumcision is most common in the United States, Canada, the Middle East, Australia, and Africa. Circumcision is much less common in Asia, Europe, and South America. There are a number of reasons parents may choose to circumcise their son. Religious reasons. Hygienic concerns. Feeling that it benefits their child's health both in infancy and later in life. Wanting their son to look like other men in the family. Other parents feel that circumcision causes unnecessary pain or disfigurement, or want to wait and give their son the chance to choose for himself when he gets older. These may be valid considerations for your family as well, and we encourage you to talk about them when making this personal choice. If your baby is born very early or with certain penile issues, your baby's doctor may have recommendations on circumcision as well. If you have any other tips, please leave them in the comments section below, and don't forget to subscribe to our channel for more videos like this. Thanks for watching.